In London we have a really big problem with sexually transmitted diseases. And what was happening was that most services weren't able to cope with the number of people that wanted to come in and very responsibly have a check.
New models for sexual health testing are revolutionizing the role clinics have in serving the needs of their communities. With chlamydia and gonorrhea, two of the most prevalent reportable STIs, having a patient-centric walk-in testing program can help transform the health of our communities.
So traditionally a lot of sexual health clinics were based in hospitals. And what we've decided to do is to move a lot more of them into the community.
We have new data that was just released showing us that we are in big trouble. We've got increasing rates of chlamydia and gonorrhea, and we've got to change how we're doing testing in the business of STD prevention.
For the last 20 years, we've seen the number of people at risk for STI increasing. We've seen the number of people having STI increasing. And I think it's clear that the actual paradigms we're delivering the patient are not working. So we have to move to more modern paradigms.
The model at Dean Street Express has been incredibly successful. We're really proud of what's been achieved there, and so that's something that we want to try and replicate, and that's why we're here at 10 Hammersmith Broadway.
I felt very comfortable coming into this clinic. I mean, it's a big open space, and it didn't feel like I was going into a hospital compared to other services that I've previously visited.
It's an existing clinic that used to run in the back of a hospital, and what we wanted to do was to bring it much more front and centre, right by public transport and right by a central road.
10 Hammersmith is now strategically located in the heart of the Hammersmith Borough, amongst the vibrant city scene.
The location is amazing. I jumped off the tube, I was in the clinic within 2 or 3 minutes.
So a lot of the work that we've done has been based on convenience to our patients.
Registration is quick, private and secure. Returning visitors are issued ID cards for faster service.
I feel much more comfortable telling a computer a touchscreen my history than a member of staff at reception.
After a brief visit with a clinician, the patient is sent to the screening room, complete with a self-guided video display for easy self-collection and a pneumatic vacuum linked directly to the in-house laboratory.
When I went into the screening room, there's a little video, and it was quite cool watching how to do it yourself and knowing that I had, I could do it instead of a clinician, and it kind of made me feel a bit more cool about the whole thing. So when I finished collecting my sample, I popped it in the pod and put it in a tube, and then it kind of whisked away up into the atmosphere, and it takes it to the lab, and I knew they would receive it straight away and that could be processed.
At the heart of this model is the innovative Cepheid Gene Expert system and Expert CT-NG diagnostic test, delivering STI results in 90 minutes or less. The Gene Expert system, transforming the health of our communities.
What's really exciting is the reduction in time to diagnosis for patients, and the time therefore that patients can get their treatment after they've been given their diagnosis, and that's seen a significant reduction. We're now talking about that in terms of hours rather than days, which is a very exciting thing, and therefore we hope that it will have a really significant effect on the amount of STIs actually in London.
What makes it revolutionary is the timeliness of results reporting and just how patient-centered it is. So it's a really important model, and I'm walking away incredibly impressed.
We decided to go with Cepheid because we felt that one of the key things that we wanted from this new clinic was to have really fast diagnostic testing facilities within the heart of the clinic, and that important result of giving patients all of their results by text message was a collaboration between Cepheid, ourselves and others, and I think that's something that patients love and have really responded to.